Colorectal cancer, also known as colon cancer or rectal cancer, refers to cancer that develops in the colon or rectum, which are parts of the large intestine. It is one of the most common types of cancer worldwide. Colorectal cancer typically originates from the growth of abnormal cells in the inner lining of the colon or rectum, forming polyps. While most polyps are benign, some can become cancerous over time. If left undetected and untreated, these cancerous cells can invade nearby tissues and spread to other parts of the body through the bloodstream or lymphatic system, leading to advanced stages of the disease. There are 5 types of colorectal cancer. Primary colorectal lymphomas refer to lymphomas that originate in the colon or rectum, which are parts of the large intestine. Lymphomas are cancers that develop in the lymphatic system, which is a network of vessels, nodes, and organs involved in the body's immune response. In the case of primary colorectal lymphomas, the cancerous cells originate from lymphocytes, a type of white blood cell that plays a crucial role in the immune system. The exact cause of primary colorectal lymphomas is not well understood, but they are believed to arise from abnormal lymphocytes that accumulate and form tumors in the colon or rectum. Primary colorectal lymphomas are relatively rare compared to other types of colorectal cancer. They account for a small percentage of all colorectal malignancies. Most primary colorectal lymphomas are of the non-Hodgkin lymphoma type, specifically B-cell lymphomas, which are more common than T-cell lymphomas in this location. Gastrointestinal stromal tumors, GISTs, are a type of rare, non-epithelial tumor that can occur anywhere in the gastrointestinal tract, most commonly in the stomach or small intestine. GISTs develop from specialized cells called interstitial cells of Cajal, ICCs, which are part of the autonomic nervous system and help regulate the movement of food through the digestive system. GISTs are generally caused by genetic mutations, most commonly in the KIT or PDGFRA genes, which play a role in controlling the growth and development of ICCs. These mutations lead to uncontrolled growth and the formation of tumors. The symptoms of GISTs can vary depending on the size and location of the tumor. Some individuals with GISTs may be asymptomatic, while others may experience abdominal pain, gastrointestinal bleeding, a feeling of fullness or early satiety, nausea, vomiting, or a palpable mass in the abdomen. Leiomyosarcomas, LMS, are a type of soft tissue sarcoma that arises from smooth muscle cells. Smooth muscles are found in various tissues throughout the body, including the walls of blood vessels, the digestive tract, the uterus, and the walls of hollow organs. Leiomyosarcomas can develop in any part of the body where smooth muscles are present, but they most commonly occur in the uterus, referred to as uterine leiomyosarcoma, and in the walls of blood vessels, referred to as vascular leiomyosarcoma. However, they can also arise in other locations, such as the gastrointestinal tract, skin, deep soft tissues, and organs like the liver or lungs. The exact cause of leiomyosarcomas is often unknown, but certain risk factors have been identified, including prior exposure to radiation therapy, certain genetic conditions, such as hereditary retinoblastoma and Li-Fraumeni syndrome, and prior history of other soft tissue sarcomas. Carcinoid tumors, also known as neuroendocrine tumors, NETs, are a type of slow-growing, generally low-grade tumor that develops from neuroendocrine cells. These specialized cells are found throughout the body, particularly in organs such as the lungs, gastrointestinal tract, and pancreas. Carcinoid tumors arise from neuroendocrine cells that produce hormones and neurotransmitters. While they can occur in various parts of the body, they are most commonly found in the gastrointestinal tract, specifically in the appendix, small intestine, rectum, and stomach. However, they can also develop in the lungs, bronchi, and other less common locations. The exact cause of carcinoid tumors is not fully understood, but some cases are associated with genetic factors and certain inherited conditions, such as multiple endocrine neoplasia type 1, MEN1, syndrome or neurofibromatosis type 1, NF1. Exposure to certain substances, such as tobacco smoke, can also increase the risk of developing carcinoid tumors in the lungs. Melanomas are a type of skin cancer that originates from melanocytes, which are the cells responsible for producing the pigment melanin. Melanin provides color to the skin, hair, and eyes. While most melanomas develop in the skin, they can also occur in other pigmented tissues, such as the eyes, ocular melanoma, and mucous membranes. Melanomas are typically caused by the accumulation of DNA damage in melanocytes, often resulting from exposure to ultraviolet, UV, radiation from the sun or artificial sources, such as tanning beds. However, not all melanomas are related to UV exposure, as some can arise from genetic factors or occur in areas not commonly exposed to the sun. The appearance of melanomas can vary, but they often present as dark or multicolored moles or lesions on the skin. Melanomas can develop from pre-existing moles or appear as new growths. They may exhibit irregular borders, asymmetry, changes in size or color, and may evolve over time. It's important to note that not all melanomas follow these typical characteristics, and some may have atypical features. Some common symptoms of colorectal cancer include changes in bowel habits, persistent changes in bowel habits, such as diarrhea, constipation, or a change in the consistency of stool that lasts for more than a few days. Rectal bleeding, blood in the stool, which may appear as bright red or dark-colored blood. Abdominal discomfort, persistent abdominal pain, cramping, or discomfort, particularly if it is accompanied by bloating or a feeling of fullness. Unexplained weight loss, significant and unintended weight loss without an apparent cause. Weakness and fatigue, feeling tired or weak without any obvious reason. Iron deficiency anemia. Chronic bleeding from the tumor can lead to iron deficiency anemia, which may cause fatigue, weakness, and shortness of breath. Bowel obstruction. In advanced stages, colorectal cancer can cause a blockage in the colon, resulting in symptoms like severe abdominal pain, nausea, vomiting, and the inability to pass stool or gas.